Hello and welcome to the mountain. I'm Dr. Ted Cibik, if you don't know who I am. And I just read something really interesting. It was an online survey that was done by Medscape. And Medscape is a very credible continuing education online program for physicians, doctors, MDs, and other healthcare professionals. And they asked the question to well over 1,000 of physicians, doctors, and specialists in Western medicine. Do you think that your clients could benefit from nutritional counseling? The surprising fact was 55% of them minimally said yes, especially when you started to get into specialties, especially like people that had diabetes or endocrine issues. But people that were cardiologists, and especially people that were into preventive medicine for cardiology, say you have family history of a cardiac event and you haven't had one yet, but you're interested in preventing that. Those people said 100% of people should be invested in nutritional counseling. So that leads me to my next point is that, ever since I was a child and I had very severe allergies and asthma, I've always been interested in food because those are things that triggered me. And so I began studying at a very young age out of necessity. I had to learn what foods inflamed me, quite literally, and other foods that did not, and how pairings of foods perhaps were even more dangerous for me than the food alone. And so I've been studying this my entire life, but later I became a traditional naturopath, which, you start to study diets and exercise and programs like that. And you look at the macros, you look at the proteins, fats, and carbohydrates. But then I got interested in Chinese medicine. And so they look at food completely differently. They look at it as the energetics of food or how food pairs, combines, and has a synergy of energy regardless of the macros. And so putting the two together is what my specialty is. And I love helping people that have and want preventative nutritional programs, as well as people who are already on their way into pathology, but perhaps we can optimize them to become better. They have less symptoms, maybe even help them to reduce the amount of medication, or like I have done for some people, get them off certain medications because the inflammation has started to balance and you have homeostasis. So there's a lot of things to do. And there's a lot of ways of looking at this. And this is how I look at it. And it may be a little bit unique, but it works. I've helped thousands of patients this way. So if this is interesting to you, please give my office a call at 724-845-1041. And let's talk about the energies that you're putting into your body, because that's actually what food is, right? It's energies, it's chemicals, but that's not so sexy. Let's talk about the energies that you're putting into your body and find an optimal balance for you in 2023. I hope to see you soon. Thank you. Bye-bye.